Hi, everybody. This is David Nevins for Citybiz List, and I am really delighted that our guest for today's program is Dr. Sam Hahn, who is the founder of the Maryland Center for Plastic Surgery. And on top of that is widely considered certainly to be one of the Mid-Atlantic's finest and young rising stars, I might add, in the plastic surgery field. Dr. Hahn, thank you for joining us today.
Thank you for those kind words.
My pleasure indeed. So the Maryland Center for Facial Plastic Surgery, tell us a little bit about that. What is it, and who do you serve, and a little bit about the history of the organization that you started.
Sure. So the Maryland Center for Facial Plastic Surgery, we're located in Hunt Valley, right off the 83 exit. We specialize in cosmetic and reconstructive surgeries of just the face and neck. And I work with my aesthetics director, Annette Luskin, to ensure also a wide array of clinical med spa treatments. So that includes things like chemical peels, hydrofacials, microblading, things like that. And we work very closely with each patient to provide a tailored and personalized treatment plan so we can help our patients look and feel their best.
So, Dr. Hahn, I understand that you personally, your expertise and training, and tell us a little bit about your training, is in the field of rhinoplasty primarily. So share some details with us.
Sure. I do a fair number of rhinoplasty, but my training is in facial plastic surgery. So my journey, I suppose. So I'm actually locally from Baltimore. I grew up in Towson, and I went to Johns Hopkins for undergrad, and then I went to University of Pennsylvania to do my medical training. So I was there for medical school and residency, and my residency was in head and neck surgery, or sometimes colloquially it's called ear, nose, and throat. And so I did 5 years of training there, and I was really drawn to facial plastic surgery, which is actually a subspecialty within ENT or head and neck surgery. And so I pursued additional fellowship training at Washington University in St. Louis that focused just on plastic surgery. And following that training, I wanted to come back home to Maryland and in this area in particular. And so that's how I got to start the Maryland Center for Facial Plastic Surgery.
That's great. And no doubt you, like every other practice and or business of almost any kind, have been at least a bit impacted by the pandemic of this past year. Share some of those difficulties or challenges or opportunities that you developed from that with us.
Can you believe it's already been a year, right? And certainly we've learned, we've dealt with our own share of challenges, and we've also found creative ways through those challenges to deal with the pandemic. So early on, when everything was kind of shut down, we still had a lot of interest or patients reaching out to us, and so we started a virtual consultation platform at that time to engage with our current and prospective patients, but maintaining distance, and safety from their own homes. And even as we've opened up our office and continued doing treatments, that's still been a very popular platform, and I think that's going to be there to stay. It allows patients to kind of reach out to us, and I can do a consultation, for them during their lunch break if they're really busy during the week. So I found that it provides a lot of flexibility for both myself and the patients, and it's been a new thing that I'm not so sure we would have adopted if the pandemic hadn't happened. Also, obviously, we focus a lot on patient safety. We're our medical office, so we want to make sure, and I am primarily doing facial treatments, and so we've maintained strict patient social distancing, thorough cleaning of our exam rooms after patients, air purifiers, those types of things to make sure that our patients are safe. And then we've also, we've held some fun events at our office for our patients, and we've been thinking about different ways on how to still do that for our patients while maintaining the social distancing. And so we'll actually be holding a remote post Mother's Day event on May 13th. This will actually be down in Rockville. And, so we still have fun ways to engage our patients and give them a little something back, but while maintaining safety protocols.
So obviously the consultation is something that you've been doing virtually and you think might continue. The surgery part of it is not something, at least not yet, right, that can be done virtually. Dr. Hahn, who should come to see you? What would they be looking for that they would seek out your practice and the Maryland Center for Facial Plastic Surgery?
So we specialize in just both surgical and non-surgical treatment for the face and neck. So anybody who has any concerns about signs of aging or looking a little tired, we've gotten a lot of patients because of Zoom calls. I think Zoom meetings has really highlighted patients, people looking at their faces all the time and realizing sort of the aging and stress on their face. So if there's anything that they're starting to notice, whether it's just preliminary and they're just curious to know how to maybe prevent, it's some of the preventative cares they can do, or they're really starting to notice things setting in and they're thinking of maybe doing something surgical. We have a wide array of both non-surgical and surgical treatments. So really anything that that if they find that they're, our consultations, I'll go through a thorough history examination, make sure, we discuss all their options. So, really anything from the face and neck.
Well, if not for the fact that there will be many thousands of people watching your answer, I would ask what you. I'm on Zoom calls all day long. I'd ask what you recommend, but let's hold that off for a private conversation if you don't mind. There you go. There you go. Good answer. Dr. Hahn, I understand you're involved with an organization called Face to Face through the Association of Facial Plastic Surgery. What is that?
So Face to Face is a program that is through the auspices of the American Academy of Facial Plastic Surgery. And this program really has two arms. One is an international arm and one's a domestic arm. And so I'm involved with the domestic side, which it's facial plastic surgeons throughout the country who signed up for providing pro bono cosmetic reconstructive services for survivors of domestic violence and also for wounded veterans. And really the goal of this program is to help in their healing process. So obviously, a lot of things that we see would be things like scars that may be quite noticeable and a reminder of a painful past. And so by sort of treating these reminders, obviously physically we're helping them, but hopefully more so emotionally, providing some sense of healing and self-esteem, confidence that might come with that procedure.
Wow. Well, kudos to you and your colleagues for that. Switching gears a little bit. I know fillers are very popular today, and that you and your at your practice you have exclusive fillers that others don't have. What does that mean? What is that called? Tell us a little bit about that and why someone should be attracted to them.
So we've recently launched a new line of filler called Revance RHA, and this filler is sort of the newest filler on market in the U.S. and it mimics the hyaluronic acid, which is a natural volumizing substance within the skin. That is what we're sort of replenishing with these treatments. It mimics the skin hyaluronic acid content most closely, and so it's really good with expression, and very natural appearing. And it's a limited release, meaning only a few practices within our region carry it, and we're honored to be chosen for one of those practices. And it just shows that our missions and goals are aligned with Revance's, and so I'm honored to be able to carry that.
And so what does it do? Again, what type of patient would be potentially seeking this?
Sure. Fillers are products that we inject under the skin to fill in, that's why they call fillers, to fill in sort of areas of lines or depressions, shadowing. And there's different techniques that I use in different areas that we can treat. Really, filler can be used in a wide variety of areas to provide rejuvenation or youthfulness. And the fillers nowadays are very can mimic sort of skin, I guess, how do I say they're very smooth and very natural appearing. And so if anybody is noticing some dark lines around the sort of the nasolabial folds or around the corners of the mouth, even the cheeks, under eyes, all those areas are areas that we treat with filler. Just
like the book says, the fountain of youth is alive and well, right, at the Maryland Center for Facial Plastic Surgery.
We're trying to do our part.
Doctor, your practice is a little bit unique in that it also shares a home, I believe, with Ear, Nose, and Throat Associates, which is a division of the Centers for Advanced ENT. I don't know if I stated that properly. What does that mean exactly?
I kind of mentioned earlier my training process. And so a lot of people don't realize that facial plastic surgery is a subspecialty within ENT or head and neck surgery. And as I was looking to come back to this area for starting my career, I had heard that ENT Associates at GBMC was one of the leading ENT groups within this area. Very good reputation, great docs, and they had been working closely with other plastic surgeons and had been, but they had not hired their own director of facial plastic surgery. And so I reached out to them, and I found this to be a good fit for me personally. And so they brought me on as the director of facial plastic surgery, and I've been able to grow that into the Maryland Center for Facial Plastic Surgery.
That's great. And Dr. Hahn, how would someone who's interested get a hold of you?
So they can find me at our website. It's mdfacialplasticsurgery.com. We also have a Facebook page, and our Instagram is at mdfacialplastics.
Very good. And before I let you go, during this pandemic, a lot of local businesses, as you know, fortunately not yours, but a number of them have suffered. So I like to ask some of our local participants to maybe help out a local business by where do you go on date night with your spouse? A good local restaurant, carry out or outdoor dining, or just where have you had some fun of late in the Baltimore metro area?
Sure. Well, I live near Quarry Lake, and so on a nice night, I'm walking distance to there. So we like to walk down to Quarry Lake. Love sitting out on the patio, either at La Food Marqueta or Citron, and enjoying a nice dinner and some cocktails there, supporting my local community business. So yeah, appreciate it.
Well, thank you again for your time. Thank you for being with us. And our guest today has been Dr. Sam Hahn, founder of the Maryland Center for Plastic Surgery in Hunt Valley, Maryland. And I'm sure, I know that almost all of our viewers are beautiful people, but in case you want to make a little improvement, Dr. Hahn is the guy to go to. In any event, this has been David Nevins for Citybiz List. Thank you so much for joining us.